Greetings. I'm Jennifer Kennedy, the lead for quality at CHAP, and welcome to this month's CHAPcast. Today I'm talking with Deborah Hoyt from Axxess. Hi, Deb. Good to see you again, or listen to you again, at least.
Hi, Jennifer. Yes, we go way back, and it's so nice to see you again. Thank you.
Well, thank you for joining us for CHAPcast today. And before we jump into the meat of our conversation, could you take a couple minutes to introduce yourself to our listeners and tell them a little bit about your role at Axxess?
Sure, I'd be happy to. So I'm Deb Hoyt. I'm Senior Vice President of Public Policy for Axxess. And Axxess is a software technology company based in Dallas. We actually have software for home health, for hospice, for palliative care, and non-medical home care. And we basically are a global company that services all of the providers within our industry that cover home-based care. So we're here as a company that wants to partner with the industry around advocacy issues because we know that your success is as critical as our success. We can only grow together. So that's why we're here. In terms of my background, I've been around healthcare for about 30 years. Started out in the hospital and health system world, worked in a hospital association. I worked on the managed care and insurance side, as well as more recently, before coming to Axxess, I was the executive director for the Connecticut Association for Healthcare at Home. So interfacing with all of the home health and hospice providers in the state of Connecticut, and also being their state lobbyist. So it's given me a really good perspective of the needs of the providers, as well as all of the issues at the state and federal level.
I know you've got a wealth of information, Deb. So I'm so lucky to be able to talk to you today about advocacy. And advocacy, wow, for me, that's sort of been something that I was tangentially on the fringe of when I worked at NHPCO. And I did, do the advocacy and send letters whenever requested to my Congress person. But it's bigger than that, isn't it? It's more than just letters, and it can seem, I think, for the sort of the average healthcare clinician, it may seem kind of daunting when you're talking about advocacy and how do I get involved and what does that mean? So why is advocacy more important than ever right now?
Yeah, that's a great question. And, advocacy comes in many different forms, so maybe we can touch on some of that throughout this conversation. But
That'd be
basically,
great. Yeah.
Sure. What advocacy is all about is creating relationships, and it's creating relationships with state, federal, and regulatory bodies for the purpose of communicating with them the value that we provide as organizations, the conditions that we're working within in terms of delivering the care to the patients, and obviously what's happening on the ground at the patient care level and patient satisfaction, and how we as an entity, as a home-based care industry or sector, are basically adding value to our nation's healthcare delivery system. So I guess when we talk about advocacy, we always talk about the ongoing threats, right? It's always about defending ourselves from threats, whether they're legislative or whether they're regulatory, but you were saying, why is advocacy, more important now than ever? And I think it's because post-COVID, we're seeing that there's a whole new aspect of healthcare delivery that is more than just the legislative and regulatory threats. It's all about the different entities that are trying to get into our space, right? Hospital at home, SNFs at home, skilled nursing facilities at home, and other payers that are becoming providers of care, right? The managed care companies are purchasing home-based care organizations and becoming the providers and the payers of care. So I think the whole concept of advocacy is communicating our value, and it's basically securing our space and claiming our space as the providers and the experts when it comes to chronic care management of huge populations at this time and in this space.
Don't you think, a good piece of that too is really explaining to the federal powers that be exactly what reality looks like, right? So here's a good example. Let's remember back on at hospice when the OIG put out those 2019 reports that sort of spawned the whole chain of events for program integrity. Well, there was the report that had 12 cases of harm, and they are heartbreaking to read. They really are. But those cases don't represent the hospice industry in its entirety, right? So yes, there are bad actors, whether it's hospice or home health or hospitals or wherever, would you say that advocacy is part of that, is to explain that it's not the whole of the community that is providing bad care, so to speak?
Exactly. In most cases, I think that legislators and our regulatory body, which is really CMS, the Centers for Medicare and Medicaid Services, they understand that we're providing high value care in a place that people prefer most, right? Their home. And people are getting what they need. It's a low cost option to being in an institution. I think they get that. I think they realize that we're certainly saving the Medicare Trust Fund considerable dollars, and we're doing it in a way that patients and their families care to be cared for. But there are always bad actors, and those are always the ones that garner the media attention. And I think that the stories that we can tell, and it goes back to how the average clinician or the individual within an office in a home health or hospice agency across the country here can get involved. We all elect our officials, right? We have state officials and our federal members of Congress on the House and Senate side. We elect them to represent us, so we have an opportunity to have a voice with them. So reaching out to them, whether it's by email, a phone call, a text, we have all these automated ways that our national associations and state associations afford us. It's the voter voice or it's the action alerts. It's an opportunity to just let them know that we're here, we're doing the best job we can, patients prefer the care we're delivering, and we're doing it with good intent. And I think that they hear us generally, but they can focus on, a small, very small percentage of negative things that do happen from time to time. But that's our job. Our job is to make sure that we're continually telling the positive story of what home-based care can do for patients.
Yeah, those stories are so important, just to really push it down to the patient and family level, and which are their constituents as well, right? Not just us, but the patients and the families who receive the care. So,
you're right. And I'm sorry, Jennifer.
No, go ahead. Yep.
So I think one of the most important ways you can influence a legislator or one of their key staff members that works on the health side for them and informs them and educates them on health issues is to actually take a legislator on a home visit. So it's
that's a great idea.
We find that if we can get a legislator to actually, when they come home on their, when they come back to their district on a break from Washington, and they're looking for whether it's a media opportunity or an opportunity for them to be out in the community doing meaningful work. We've had many agencies that have invited them in and said, do a ride along with one of our nurses and visit, Mrs. Smith in the community. She's having a home health visit. We want you to see what it's like to actually open the door and walk into a patient's home. There's nobody else that does that, right? Everybody is always going to an institution for care or going, to an outpatient facility for care. To actually turn that door handle and walk into a patient's home, you're entering into a very unique situation. And when legislators see that, it really is mind-opening to them. And they see the documentation process right there, whether it's on an iPad or a laptop, they see the interaction with the patient. I think that has changed many minds. And I think when it comes to educating decision makers and policymakers, once they've had that experience, whether it's with their own family member or, through one of our agencies doing that, it's changed their way of thinking. And they normally become champions for our industry as a result.
Yeah, I think it's so important for someone who is making decisions about a particular area of healthcare to actually see it in action, for real. Hey, before I forget, Deb, it's going to be great to see you at the AGILE conference coming up in April. I'm slated to be there and not only do a presentation, but participate in that dementia virtual exhibit. So I'm really looking forward to that. But for those who don't know what the AGILE conference is, can you tell a little bit about it?
Thanks, Jennifer. Yes, actually, Axxess is hosting the first annual AGILE conference. And it's the Axxess Growth, Innovation, and Leadership Experience. That's what AGILE stands for. It's April 17th through 19th in Dallas, Texas. And we're going to have everything from a virtual dementia tour with AI, all the way to keynote speakers. There'll be multiple breakouts on home health, hospice, home care, and palliative care. And I know Chap and Jennifer, you're going to be involved. I'll be facilitating, I think, 3 or 4 of the home health breakout sessions. But it's a wonderful opportunity for individuals from CEO level down to CFO, clinicians, counselors, grief counselors, anybody at all levels of the organization. Everybody, there's something in there for everybody. And if you're interested in learning more, you can go to axxess.com/agile and you'll see the itinerary and an opportunity to register. Thanks so much for asking. And I look forward to seeing
excellent.
you there.
I can't wait. So I know you've got a lot of things on your plate, I'm sure, Deb, as the advocacy lead at your organization. What do you think or see the most important issues we need that need a boost for provider advocacy?
That's a great question. And boy, we could talk for all day long about that.
I'll bet we could.
One of the things, though, that I love about my role is that Axxess has afforded me the opportunity to be part of boards and committees of our national and state associations. So I have the opportunity to listen in on, multiple committee calls, sit on boards, go to board meetings in DC, and do Hill visits, what we call Capitol Hill visits, and actually meet with legislators. So as part of my work in doing that, I'm learning about how the national associations are working collaboratively more than ever now on issues that are important to home health and hospice. Most of that centers around making sure that our Medicare trust fund is sustainable, right? Making sure that Medicare dollars are going to be there. And then us as providers and as an industry, we need to be responsible stewards of those dollars. We have to bill appropriately. We have to document appropriately. We have to do all those things to make sure that our claims are clean and all the things that CHAP does to ensure compliance. That's all critically important. So, you asked what some of the big issues are that we are working on right now. On the hospice side, you alluded to it earlier. The hospice fraud reports have been coming out, whether it's been through Wall Street Journal articles years ago, and now some of the more recent reports talking about how some hospices are fraudulent, how there's either...
the ProPublica series is really bad.
That was a big one.
Yeah,
it was really bad.
Pretty big.
And what they're finding, Jennifer, is that, there are hospices that are doing great work, but then there are hospices that are, have many, many different provider numbers. There are many that are located at one location. They know that there's several different hotspots, and I know most of those are in probably 4 different states, and you know this as well, right?
I do. I do. Yeah.
California, Arizona, Texas, and is the last one New Mexico, was it? Or I'm trying to remember.
I think New Mexico, yeah. It's concerning for sure.
It's really concerning. So without getting too deep into that, I know that NHPCO, the National Association for Hospice and Palliative Care, and NOC, our National Association for Home Care and Hospice, have kind of unified and come together and actually said, well, instead of kind of playing defense all the time, advocacy is not just playing defense on, legislative and regulatory issues. Let's be proactive and let's propose some, educational opportunities for these members of Congress and for these state legislators and be position where we can be the subject matter experts and say, here's why there are problems. Let's not just complain and say there's problems about hospice providers. Let's say, this is a specific reason why these hospices are doing what they're doing, because maybe there's a breakdown in some of the regulatory oversight, or maybe there's an opportunity where we as an industry can police ourselves. We can actually help you as a regulatory body, CMS, to be more compliant. And let's put together some of those criteria so that we can work together. Our whole goal is to be really compliant and to be a successful provider entity that can provide great care. That's our goal, right?
This sounds, what you're explaining, it sounds so much like quality improvement, doesn't it? You have to figure out the reasons why things are the way they are, or the current state of things, in order to figure out what interventions do we need to put in place to make things better, right? I mean, that's the loop that you go through, whether you're looking at compliance issues, quality of care issues, process issues, whatever it may be. And I love that approach because, it's going to Congress and saying and complaining doesn't seem like they would be very responsive to that. We own what we own, and if we can give them the insight that they need, there could be benefits that could come to hospice, rather than constant penalties, which seems like that's been the trend over the last couple of years, right? So I think when we're talking about partnering, you have to partner with your advocacy people. Is that fair to say?
Exactly. And, sometimes we don't really think of it, or it's not top of mind, but the federal government is our largest payer, and we need to actively engage with Congress, the administration. Right now, it's the Biden administration, and the regulatory body that oversees us, right? So,
Right.
It's CMS and others. So we need to be an active partner as opposed to be kind of a passive recipient of whatever might come down in a proposed rule and a final rule. So I'm really encouraged by seeing our national associations and the state associations become more proactive partners. So on the hospice side, we talked about, self-policing, different types of compliance proposals we can put together on the hospice side. And there is a senator right now that's kind of chairing that activity. And it's a representative, House Representative Blumenauer, who's basically taken that work up and is meeting with the leaders of NAC and NHPCO and many of those large hospice providers to say, okay, let's pull this together and see how we can reframe this and actually look at how we can improve the delivery of care under hospice, exactly to do what you were talking about, so that we don't have a hospice cap cut, so we don't have, reimbursement cuts. We actually want investment in hospice because we've seen that it's saved, billions of dollars over years in terms
Absolutely.
of, the American healthcare dollar. So that's on
Absolutely.
the hospice side, at least.
That's great. That's great news to hear, Deb. So let's kind of shift gears a little bit. So how can anybody get involved in advocacy? Let's say I am, a nurse working in an organization, and I feel passionate about what I do, which sounds like me so far. I'm just sitting in a different chair and not 2 feet in the ground in a hospice anymore. But how could I get involved in advocacy if I had that passion?
Okay, so it's super easy. I'm so glad you asked this question, because people oftentimes say, I want to get involved, but I'm like afraid to call a senator or a congressman, or how do you even go about doing that? So it's super easy. There's probably 2 or 3 different avenues to reaching your United States senator and United States House member, right? So I live in North Carolina. I have depending on my zip code where I live, I have a House and a Senate member. And I also have state representatives in Raleigh, North Carolina, which is our state house. So you have multiple opportunities to weigh in, whether it's a state bill or a federal bill. So what you can do is either go directly to their website. They oftentimes have like a little, reach out to me or, contact me. And you just can click a button, say, I want to contact you on a health issue or an energy issue or a personal issue. And you could click health, and then you can, type in, a small comment if you'd like to do that. or you can use our National Association websites. We have call to action opportunities under the Advocacy tab of our NAHC.org website or NHPCO.org on the hospice side. They have an advocacy tab, and it'll say become an advocate or advocate now. And you can click that, and it'll pull up on the screen all of the key priority issues, whether most of those will be federal issues in Congress because those are federal associations, national associations. And you can actually click on each one, and it will pull up a preformed email with, all of the different talking points that the industry, the United Voice, has kind of put together on that issue. And you can literally, put in your name and address and zip code and hit send. It will automatically link you to your elected officials based on your zip code. And you can actually do that using your work zip code if you work in a different state or a different county, or you could use your home address. So there's an opportunity to do it actually twice on an issue. But you can at least educate yourself too, because there's usually a one-pager with talking points on what the issue is about and why it's important, on many different levels to you personally, to you and your family personally as consumers, and also to your organization or agency, and then obviously to the industry. So getting involved is not as hard as you think. If you're interested, always reach out to your state or national association, and they can direct you to their website on their advocacy page.
Well, it seems to me like ultimately getting involved in advocacy, you're ultimately advocating for patients and families, aren't you, really? Because everything that comes out of your participation in advocacy is going to trickle down to that actual care level eventually. So that's a positive all the way around. So hopefully everyone will take your good advice and look at all of those different avenues to get involved in advocacy. And, you mentioned going to the Hill and talking about issues. And it really seems that when we go to the Hill, it involves compliance and, the challenges that your provider out there in their community is facing. So, when we look at that aspect of compliance, how does Axxess or what is Axxess doing to help providers with that piece of it?
Yeah, that's a great question, Jennifer. So obviously legislators kind of have their preformed notion when you go meet with them in person on Capitol Hill. And usually it's a negative one, which is really interesting. It's because they haven't been fully educated about the compliance measures that are in place within our sector. But when you talk about Axxess, I said we're a technology company, we're a software platform and EMR. When it comes to compliance, Axxess is very, very interested in making sure that whatever agency or organization is using our software platform has tools that are so easy to use and automated so that compliance is like top of mind and the first thing that always happens. We try to code things so that you can't do things improperly in terms of making sure that everything is proper. But it's all about being compliant. We have intuitive documentation and coding. We have benchmarking and business intelligence and workforce management tools built into our software. That's what a technology company is supposed to be. It's supposed to be a partner that helps you be as compliant as possible. And then on the flip side, when you have an audit or a survey, the surveyor will be able to print out that documentation, and in Axxess, software prints out just like a book, and it's really easy for them to read and then review, each individual patient record. So that's our goal, to be the perfect partner to the provider on compliance issues. And this way we can, head off the challenges when it comes to, when you were talking about bad actors, most of the time it's not intentional. It's because something has been unintentionally, coded improperly or documented incompletely.
Yeah, I agree with you. And I'm sure our site visitors here at CHAP would thank Axxess for the ease of the documentation, because, we know that it doesn't matter what area you're practicing in. Care delivery and quality care delivery is top, but translating that into documentation that shows the excellence of that care delivery is really where it's at. No matter if you're going on, if you're under a compliance survey, or you're under a compliance audit on the cost side, right? It's all about the documentation. So that's great. And, we're so happy at CHAP to be partnered with Axxess, because we equally feel that compliance and quality are our mission. Obviously, we're out there surveying and doing oversight to make sure that providers are compliant with regulations, but also the intent behind the regulations is delivery of high quality, safe care. And that's what we're all about. And we've really worked hard in 2022 with our Center for Excellence to develop some programs that would help providers understand regulations, understand what the aspects of complying with those regulations look like, and also, upping their quality needle personally by going through some of these programs, such as hospice operations certification. So I think we have a beautiful partnership together that gives providers what they need in order to walk that high compliance road.
I agree. And likewise, Jennifer, Axxess really appreciates I think we're the first CHAP verified software platform in this space.
Yeah, congratulations.
Thank you. We really value that, and we think that it's really important for us as a technology vendor to be fully aligned with you, because if we can't be fully aligned on the quality and the documentation side, then we aren't doing our job. So I'm really, really happy that we have this partnership.
Absolutely. Well, Deb, thanks for joining the podcast today to talk about this really important topic of advocacy and, how people can get involved and what it means. Do you have any closing thoughts for me and our listeners?
I guess, the only closing thought on advocacy is that this really is not an option. People oftentimes think, well, my state association and the lobbyists and the federal national associations are handling everything for me. Legislators don't want to continually hear from the lobbyists and from the associations. They want to hear from the actual frontline clinicians. They want to hear from patient families. They want to hear from the people on the ground that have received this care. That's so meaningful. So, if you can take 5 minutes, if you're a clinician, to actually go to the websites of our national associations, it's free. It doesn't cost you anything in terms of, much more than 2 or 3 minutes of your time to go in and weigh in on the most critical issues. And when we get 10 or 20,000 emails being sent to members of Congress, because all of you actually can take a few minutes to do that, it helps. That is what backs up and helps the lobbyists and the association staff when they go in to meet with the individual member of Congress, because they're like, wow, I just received all these emails. Boy, you've got quite a cohesive industry that is all speaking together on the same issue. So thank you to everybody that performs the action alerts and goes and advocates on behalf of yourself, your family, your patients, and your organization.
Right. Many, many voices move mountains, right, Deb?
Absolutely.
All right. Well, thanks again for joining us. And the CHAP team and I thank you out there in podcast land for taking time out of your day to plug into the CHAPcast. I learned a lot today, and hopefully you did too. So from CHAP, stay safe and well, and thanks for all you do.